America. This afternoon, we have with us Jesse Hunter, who is Executive Vice President at Centene Corporation. He's been with Centene 14 years. I'm proud to tell you that he has a Master of Business Administration from Washington University, and I know that he is therefore prepared to be a great leader, and he is. So I would like to invite Jesse Hunter to come forward for his remarks. Thank you all for joining us this afternoon.
Thank you, Chancellor. And it's fitting that we set a high bar in my remarks as we're setting a high bar for the future of the Envolve Center here as well. So on behalf of Centene Corporation, I'd like to say thank you. So thank you to the Chancellor, thank you to Washington University, and thanks to all of the interested parties and participants in what we know is going to be a very exciting and very impactful future for the Envolve Center. One of the things that we'd like to talk about is our appreciation for the combination of these prestigious academic institutions in collaboration with Centene. We've had the opportunity to work with both Duke and WashU independently over the number of years. That's really been a privilege and been impactful in terms of the work that we've done. But I think we have the benefit now of really collaborating in a unique public-private research collaboration, which will really take us, collectively to the next level. So many people, and appreciate the Chancellor's remarks about Centene, but many people know a bit about the organization. We're a multinational Fortune 200 healthcare enterprise. Some people don't know that the purpose of Centene is to improve the health of our communities one individual at a time. And that's obviously directly in line with the objectives of the Envolve Research Center. But not everybody knows about Envolve itself. So Envolve is a relatively new part of the Centene family and really represents the combination of our specialty services. We have for a long time been advocates for the integration of the healthcare delivery, so whether that's behavioral health services or pharmacy, vision, dental, et cetera. Envolve really represents an integrated collection of those services that we use to not only benefit Centene and our efforts, but also for the benefit of third-party customers as well. So this is, as I said, a relatively new endeavor, and one of the overarching goals that we've established for Envolve is to create an easier path to a healthier life. And that's fundamental to really achieving our broader, not only the Centene goals, the Envolve goals, but also our societal goals in terms of the impact of individual health on the whole. But what we found as we were going through our effort is there's surprisingly little science and research and outcomes with respect to how do you demonstrate, the impact of individual health decisions, and how do you understand what those things are going to, what choices are going to have a positive impact both individually and collectively. So we understood that science didn't exist, so we've endeavored here to create it, or help to create it. So that's really the biggest impact that we collectively can have through our efforts here. And I think there's no way that we can get there, our individual and collective goals, without working together to create the deeper understanding of individual health choices. We'll hope to hear more about that today and more as we go forward. So we again appreciate everybody's time and interest, and as excited as we are about the impact that this can have on Centene and our nearly 5 million individuals that we help support in terms of their health choices, we know there's an opportunity to extend that for millions of people beyond Centene around the country and across all spectrums of the healthcare delivery system, the age continuum, the income continuum, and the acuity continuum, from people who are well to people who have the challenge of living with a chronic condition. So we at Centene are committed to serving underserved populations, and we hope that all the efforts and outcomes that we'll learn through the Envolve Center will allow us and others to benefit from those learnings. So as excited as we are to launch today, I'm even more excited to learn about, hear about, and then communicate the findings that'll come from the great teams that we've assembled. So thank you very much. And now I'd like to introduce John Porter, our Executive Director for the Envolve Center. Thank you.